Hi, my name is Dr. Retner, and today we're going to be demonstrating applied trigger points. These are applied because people are aware of trigger points, but they're not aware exactly what does what. And so first we're going to show different methods of working trigger points, and you should be familiar with all these because some people will prefer one to another. And we'll also be demonstrating how to correct the sacroiliac joint, how to treat different problems with premenstrual syndrome, sleep, and also correct postural subluxation. Then you can also do direct pressure to the area with your thumb, and you should reinforce your thumb so you don't subluxate your thumb. And you just apply direct pressure for 7 to 10 seconds. Another form of method for release of trigger points is something called orthobionomy, where you would contact the trigger point and then lift the closest body part and then slowly lower it and feel for release. So there are very gentle methods. This has no pain involved at all, and this will release any trigger point in the spine. I will now demonstrate a series of trigger points that can be used in conjunction with the biophysics technique. I will demonstrate the head rotation. So if the head is rotated to the right, we will work the trigger points again on the chest. And the trigger point for the head rotation is the fourth rib lateral to the nipple line. The head was rotated to the right, so it's on the right side, and we find it. You go just lateral to the nipple line on the fourth rib and palpate, and you'll find a trigger point. With lateral head tilt, that's where the patient comes in and you find the head like this. You can work the trigger point either on the chest or on the back. You can find trigger points in both areas. For cervical hypolordosis or anterior weight bearing, you will find a trigger point on this patient's spine, on the fifth, just lateral to the fifth thoracic vertebra. You can also find trigger points with hypo and hyperlordosis of the lumbar spine. Okay, and again we're going to test. Hold the trigger point strong. Sacroiliac, hold, that's strong. Lie on your back, please. Hold your arm up. And hold, the fossa is strong, put your right leg over the side of the table, and hold. The sacroiliac is showing strong under stress. Now we'll test the temporal bone on the right, hold, and that's strong as well. So that one trigger point, without any blocking, has corrected all your indicators. So this is a very important procedure, and it will speed up your the healing of your category 2s if you do the SOT technique. If someone comes in with sinus congestion, you can find a trigger point. There's an effect like a stocking over the head, and the trigger point is pulling on that, making it tight. This will release the tightness of the sinuses. The patient will find their sinuses draining after 10 seconds of this trigger point work. If a patient has trouble sleeping at night, there's a trigger point. The trigger point for P.M.S. is found on the right lateral thigh. Chakras are spinning whirls of energy that are located both inside and outside of the body. They occur out of balance when you have an emotional upset or an organ problem. There's a patient of mine who had trouble having her period, and we worked the second chakra trigger point, and 3 hours later her period came on. So these do release a lot of tension and can assist the body in functioning. In order to release trigger points without using deep pressure, what we do is therapy localize them along the spine and then use the double activator in order to release them. So for example, we have the second cervical here. There's a trigger point there. I can feel it. It's tight. Does that feel tight?
It's very tight.
Okay. Now, hold your arm up. Hold. Now, the 3 points for that are T2, 4, 9. So I'm going to adjust that with the double activator. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay, next we retest and hold. Lo and behold, it tests strong, and there's less tension there now, right? The advantage of using this method is if you have a hot, low back, very often you don't want to touch directly on that area because it will cause the patient much discomfort. So instead, you can stimulate other points along the spine, get a release through the nervous system, and relieve the patient of pain without causing them more pain. Now I'm going to be demonstrating the different aspects of sports massage. The first part will be origin insertion work. Usually when we have a spastic muscle, we want to weaken it and make it more relaxed. Next we do transverse frictional massage. Grab a tight part. Is that tender in there? Mm-hmm. Okay. Take the side of the hand. This third part is trigger point therapy. There's a trigger point right here, just a knot in the muscle. Take your thumb, reinforce it with the next finger. Take a deep breath in. As she exhales, I'm going to go in halfway. The next aspect is the soft tissue fixation mobilization. For that, we check the range of motion of the muscle. The next aspect of sports massage that I'll demonstrate is working with the fascia. First, we motion palpate the fascia to check for restrictions, and it's restricted right in the middle section here of the trapezius. So we take the distal part of the phalanges. This is very rewarding work, especially with your sports injury patients or whiplash patients. I once had a patient who had a scoliosis that when I looked at his x-rays, I said, oh my God, it was curving right and left, and it was amazing to look at. And at the bottom of his spine, in the lumbar area, he had a swollen muscle mass that was hard and knotted, about as big as a softball. And I worked on it, doing these techniques, and at the end of the treatment, it was about 1/4 the size, and it was soft mush instead of being hard like a rock. And I felt like a sculptor sculpting his body, and it felt so rewarding to see the changes. I felt like a real healer. It's an amazing experience. So I highly encourage you to try this work, and I think you'll find it rewarding as well.